Hi, good afternoon, everyone. So it's 3:01 here, so I think we can get started. Thank you all for joining us for the Ask the Expert Live on treatment and care. Just before we get started, I just want to mention that this whole session will be recorded. Please keep your mics and videos off, and if you have any questions, please share them in the chat, and also please feel free to include your email address so that if we don't get to your question today, we can get back to you with an answer in the next few days. And so with that, I'll introduce myself. My name is Perka Ahmed. I work with the synthetic drug strategy here with UNODC in Vienna. As a part of the synthetic drug strategy, I work with a team that manages the UN Toolkit on synthetic drugs. The toolkit was created to support the international community in countering the global synthetic drug problem by bringing together a host of tools and resources across the UN system in one place. The toolkit and using the toolkit and accessing the toolkit is quite easy, and I will share my screen now to show you how easy. So with that, I will open up my screen now, share my screen. Yes, so the best way to access the UN toolkit. We start here with the syntheticdrugs.unodc.org, which takes us to the page where you can access the synthetic drug strategy, information about implementing the strategy, and then, of course, the UN toolkit on synthetic drugs. As I was about to mention, the UN toolkit is available in all 6 official UN languages. And in this case, I think English is the best option, so we'll go here. This takes you to the registration page for the toolkit, which you can do quickly and easily here. It only takes a few minutes. I'll just fill it out here. And once you register, you will get a link to enter the website. So let's hit submit here, and voila, here's the link to the synthetic drugs page, which will take us to the landing page for the toolkit. Here, again, you'll find information about our upcoming events or new modules that we've published. In this case, you'll see a link to this session today. We have highlights, various videos about the toolkit, as well as our Twitter feed here. Up on top, you'll find a link about us, which gives some background on the toolkit itself, why it was created, and as well as a summary of the various modules. At the moment, we have 11 modules, the most recent being advanced investigative techniques. We have obviously treatment and care, which we'll be talking about today, prevention, postal security, forensics, legal, access to medicine, precursors, early warning, cybercrime, and COVID. Then when you come up here, you'll also find a page on our partners. As I mentioned, the toolkit is co-developed with various partners across the UN agency, UN system. So the World Health Organization, INCB, UPU, the World Customs Organization, ICAO. And the idea is that we work with them to sort of put together these modules, share the resources that they've developed, and to have all this information available in one place. Up here, you'll also see a link to our Ask the Expert. So while we're hosting the session today live, you also have the opportunity to submit a question whenever you want. So it leads you to a short form here where you can ask a question, which we then pose to an expert. And we get back to you as soon as we can. Then over here, we have highlights. Here you can watch previous Ask the Expert lives. We've hosted one on early warnings, forensic, precursors, postal service, cybercrime, access and diversion, and so on. And then, of course, there's the toolkit itself. Here you see all of the 11 modules that are currently available. The idea is that each of these modules offers you a set of particular specific resources that pertain to that module. Because we're talking about treatment and care today, I will go here. And the format and style of each module is pretty much similar. You enter the page, you get an overview, which summarizes the type of information that's in the module, the intended audience, what kind of resources are available. And then we have each module broken down into subsections. In the case of treatment and care, we have it broken down in 3 subsections, one on the management of drug use disorders, one on opiate overdose, a third one on the treatment of drug use disorders. And obviously in each section, you can see that there's also subsections there. So just to quickly take us through the management of drug use disorders, we have facts and figures, also different resources listed here, how to identify drug use disorders. We have guidelines and tools, which I'm sure our expert will delve more into as we get into the questions today. So just to take us also to the opioid overdose page, again, a summary followed by some guides and resources towards the bottom, these ones pertaining to opioid overdoses. Here in the treatment section again, we find subsections on special populations, something that, again, I'm sure our expert will delve more into later today. So that's the module itself and the toolkit. As I mentioned, today's session will be focusing on this module, which was co-developed with WHO and funded by the Government of Canada. And with that, I will now introduce our expert. So I will stop sharing the screen now. Hello, so today our expert with us is Anja Busse. She's a program officer with PTRS, the Prevention, Treatment and Rehabilitation section at UNODC. She's been involved in the implementation of UNODC global programs on drug dependence, treatment, and care since 2005, and we're very lucky to have her here with us to answer some of the questions we've received. Thank you so much, Anja, for joining us today.
Thank you so much. Sorry.
I just wanted to mention, so everyone's welcome to post questions in the chat, but also as a part of the registration process for today's event, we received a lot of questions. So I suggest we start with the questions we've received and kind of go through that. So if it's okay with you, I'll jump right into it.
Sure.
Okay, great. So one of the first questions we received was from a healthcare provider, and they asked, our hospital has seen a growing number of relapse cases with patients who have recovered from drug use disorders related to synthetic drugs. Are there effective relapse prevention standards that can be included in our treatment services?
Thank you so much for the question, and Pekka and everybody. If you allow me, just before answering the question, just would like to make maybe 3 small general remarks. I mean,
sure.
First, I mean, as you said, I mean, today and in parallel to this and here, we are commemorating the International Day Against Drug Abuse and Illicit Drug Trafficking. And I think this year's topic is especially relevant also for the session we are talking about. And it's people first, stop stigma and discrimination while strengthening prevention. So I think that's, you know, just good to remind as we go into this. And then I just wanted to say, if anybody kind of on the call or listening to this, you know, is struggling himself or herself with any problems related to substance use or has a loved one who does, it's really important then, you know, to get individual guidance with a local healthcare provider and so on, while, you know, in forums like here, we can just share general remarks and refer to general guidelines. And then I will really go back to the question. Just wanted to say a little bit regarding, you know, as we're in this context, focusing on synthetic drugs, how those can really take a lot of shapes and forms and be very diverse in terms of their effects and the drug classes and so on. And obviously some of them have a very legitimate medical use, right? And then the problem though even might be that prescription drugs can be used for non-medical purposes, and that is a risk. Or some synthetic drugs, so to say, you know, are not coming through any medical channels, but are really just coming from the illicit drug markets, like, you know, this year as we are presenting World Drug Report has been highlighted very much again. So with these just 3 remarks, let me come back to the question where you were asking, so to say, about, or you were kind of describing this question from a hospital that apparently successfully has managed to treat people with different kinds of drug use disorders, including 2 synthetic drugs, and has seen relapses occur. So maybe and then kind of the question around effective relapse prevention strategies. And maybe just to say first, and you will find that definition including in the international standards for the treatment of drug use disorders that you have in the toolkit for you, is that UNODC and WHO have described drug use disorders often as biopsychosocial health disorders that can take the course of a chronic and relapsing disease or disorder, right? So in that sense, I think the first notion really is it's great that you know, treatment has worked for you, and we also need to consider with any other chronic health disorder that relapse can be part of the journey. So, and the important thing in that case when people are relapsing is to keep the door open, to readmit them, to not increase stigma, to not increase barriers, and so on. Then I would say classical relapse prevention strategies often include things like cognitive behavioral therapy to identify triggers for substance use, to learn skills, kind of what happens when you're, let's say, going back to an old environment or meeting friends that usually you have known from time when you have been using drugs. So all of this can be trained and is part, for example, also of our TreatNet training package, which you also have as part of the toolkit. So there is one training module especially that's looking into relapse prevention strategies, such as those that I mentioned. But I would also broaden the question a bit beyond relapse prevention and really focus on what we have framed, including in the drug treatment standards, as sustained recovery management, which is really like a perspective of continuing people even beyond this period of intensive psychosocial or pharmacological treatment on their kind of way of you know, leading a healthier life with reduced drug use or abstinent to drug use, depending what kind of their you know, highest attainable standard of health will be. And so what we there have said is that recovery management really includes a number of areas, right? So health, physical and mental health is obviously part of it and is core of it, but you also may want to look into other areas that need to be addressed, and that need to be addressed also with the way what's the most pressing or urgent issue for somebody who maybe has lived on the streets or has in the past years mainly focused kind of on substance use, and now kind of returning to living a full life. Aspects such as family come in, maybe some legal aspects need to be sorted out. There might be questions around housing. There might be issues of, you know, finding a community to reintegrate in. So all of this kind of we have discussed around recovery management, and you will find that in the treatment standard there actually have been a few principles named, you know, which are maybe not written in stone, but very much based on good practice for recovery management. And that would be one, to take a strengths-based approach, right? To rather look at what the person can bring and what skills can be developed instead of looking at deficits. And then to have rather flexible support programs than fixed, because also, you know, as people are longer in recovery, maybe they need less connection with the services, but they might still benefit from having a telephone number to call, especially in times of crisis. And for many people, like public holidays, you know, when everybody is celebrating with a family or so, you know, these are often times of crisis for people with mental health or substance use disorders. Another principle is to look at the patient's autonomy, so that the health service provider does not need to do, or the social provider does not need to do everything for the person, but it's rather enabling kind of them to manage their own life. And that sometimes starts with, you know, how do I get an ID card? How, after I have my ID card, do I access social services? Or all of these things, right, that, you know, maybe also you can put under life skills, but really to enable people to do that and thus strengthen their own autonomy. And then kind of, I think, really community participation, which I mentioned a little bit before, and finding a good social spot for yourself, I think, is another important part of recovery management and thus of relapse prevention. So in closing, just to say, I think relapse prevention techniques, right, are something that actually can be trained and learned and have a lot to do with learning skills while identifying risks, kind of, and also identifying when there are, let's say, personal crisis moments, when the urge to, again, use substances or use more substances or use substances again in a more risky way kind of is growing, and what you can do, kind of call a peer, return back to your health provider. And then this idea of sustained recovery management, which is, you know, slightly broader and looks at kind of the entire process beyond a more, let's say, narrow treatment period. So yeah, that would be that for the first question, maybe.
Yeah, thank you, Anja. And I think that's an important point that you made, was that actually there's a tendency to see treatment and care only within the lens of just like healthcare providers, and that it's actually a very multifaceted approach, that it requires communities, families, like a whole system and structure around it. So it's not just, you know, within that lens of healthcare providers. So yeah,
maybe just to say and to point to another tool you have linked on the toolkit, there is a link to our or an overview of the trainings we provide for policymakers, right? And usually when we train policymakers in a country or so, which is then a bit broader, it's on the nature, prevention and treatment of drug use disorders, we really try to bring together multi-sectorial groups. So that Ministry of Health is there, but also education, maybe justice and so on. And I would think that for treatment as well as recovery support, you know, again, we would, as much as feasible, right, because resource limits are also real, like to encourage multi-sectorial teams or multi-professional teams.
Yeah, thank you. Okay, so looking at the second question, we received this from someone in the US. They asked, there's a growing number of reports on the use of synthetic cannabis in prisons in our region, with many physical, mental, and behavioral consequences. What are some ways to offer effective treatment and care to people with drug use disorders in these prisons?
Yeah, very important question. And I'll again take a tiny step back and then come directly to the question. So, I mean, when we are talking about drug treatment for people in contact with the criminal justice system, or in this case, in prison settings, I think it's always important that we first remind the importance of considering alternatives to conviction or punishment, right? So that people in prison are really those that belong there for the severity of crime, and so they have committed, and that in all those cases where maybe the crime or the offense is of a more minor nature, which could be kind of offenses related to personal use of drugs, that to the extent possible in national laws, of course, alternatives to conviction or punishment may be considered, right? So that's just as a first principle. But then regarding the question on synthetic cannabinoids being used in prison, I mean, that's something we have heard and seen also from other parts of the world. And I mean, my understanding is to some extent at the illicit market, the synthetic cannabinoids have been developed, among other reasons, kind of for settings such as prisons, but also for people that might have to go through other types of drug tests, because kind of their use would not immediately be picked up by typical tests that would test, for example, for cannabis, right? And the other thing is, you know, they can be in very small quantities brought into prison. So the risk with those is that I think in a way already the question hints at that they have a higher likelihood for the onset also of mental health disorders. And that is partly due to the fact, and again, if we are speaking of synthetic cannabinoids, those can be very different batches, different suppliers. So it's not always the same thing, but, in general, I mean, one part which is often missing in these synthetic cannabinoids is cannabidiol, CBD, which kind of in cannabis is a little bit kind of balancing and might have a slightly protective effect against the full development of mental health effects. So this is missing in the synthetic ones, and thus kind of the possibility for mental health symptoms is much higher, right? And I mean, so there are actually quite good guidelines developed, honestly speaking, not so much by UNODC. We do have some training materials on those. But in the UK, the Neptune guidelines have been developed, and I think those are really a very good standard for any treatment of synthetic substances, such as cannabinoids. And they differentiate between managing acute intoxication and then kind of the ongoing treatment. And for acute intoxication, it's really the focus is on treating the symptoms, right? So people might come up with some sort of delusion. They might kind of, in worst cases, maybe have a seizure. They might present with mental health symptoms. There might be some physical symptoms that they present with. And the recommendation is really to focus on treating those symptoms, because in reality, I mean, unless really a toxicology is done and all of that, but in an acute situation, you cannot wait for this. The focus is on treating those. And then, so to say, when it comes to the longer term treatment, I would also think that there is very little specific guidance on treating, especially synthetic cannabinoids. But what we learned from is kind of from the treatment of cannabis use disorders and so in general. And there, our main treatment is really evidence-based psychosocial treatment, right, which can also be offered in prison settings. And so even in prison settings, there are sometimes like these office-based treatment settings. Sometimes some prisons also have what they declare as drug-free wings, kind of where treatment especially takes place, but interventions that you find, for example, listed in the International Standards on Treatment of Drug Use Disorders that you have in the toolkit, or in WHO's MHGAP kind of toolkit, which in principle is designed for primary health care. But I mean, those can also be applied, and I think especially effective in prison settings has been, for example, in terms of psychosocial treatments, cognitive behavioral therapies. There is kind of also a review that says that therapeutic communities in prison settings can be effective, but that was mainly with an outcome of reducing reoffending. I'm not 100% sure actually that those have this high level of evidence also for reducing drug use related outcomes. So, but that's more or less kind of where we are at, right? So if there is an emergency, deal with the emergency. If people show direct intoxication, then there are longer term, especially in this case, psychosocial treatment strategies. I think one thing which is also important is to inform people using synthetic drugs, in this case, cannabinoids in prison settings, and make sure they're at least aware of the risks associated with this. And because, you also don't know where their information is coming from, they definitely have no control over what they are using, because it's hard enough to get any of these substances in prison. So, I mean, it can also be that, they have, for whatever way, received for a while a substance that, they thought in a certain quantity did not give them too many negative effects. And then, they get something else and they end up in a full mental or physical health crisis from that. So I think, that is, among other things, important. I think, for all, maybe just to mention, because it's a simple intervention, that really, I mean, in the symptomatic treatment of many synthetic substances, it's really important to not forget that people are well hydrated, right? So hydration and avoiding dehydration is an important part kind of when addressing especially intoxication. So maybe just to keep in mind. And I mean, then there are a few general principles for treatment in prison also, maybe to end with those. And I think for us at UNODC, it's also important that, because we also support broader prison reform projects, that there are a few things that are maybe not sounding like immediate health interventions, but that are core to health, right? To kind of address prison overcrowding so that people have, a place to sleep, or things like proper ventilation and so on, right? Proper food, having possibility to move, to exercise, all of these kind of having human rights in place. All of this is, of course, in general, contributing to health. And then I would say other things that are more at the high level and important also for drug treatment is to conduct screening and assessment early on when people enter prison. So maybe that has happened before when they were in pretrial detention, but nevertheless, I think that's important to address. And then that the staff, and not only the health staff, but also the general health staff, kind of are aware of potential symptoms and the potential risks associated, and would be ready to respond early enough when they see symptomatic behavior. And also that they are, for example, in general informed about, drug use disorders as health disorders, and maybe have been through some trauma-informed treatment and so on, just to be to really help that also in prisons. The response to this is first and foremost, especially when it comes to life-saving issues, a health response. And I mean, one thing, maybe going back to the question, I mean, around the mental health symptoms, I guess, especially here, but also knowing how difficult that is to do in many prisons in the world, would be to see if we can have integrated treatment approaches, right? So that can address both substance use and mental health issues. Mm-hmm. Last thing, maybe, people are leaving prisons at some point, and that is the other thing of important to prepare kind of for release to the community and have linkages with community health service providers, social providers, and all of that, especially for people with substance use disorders, that might need continued care there.
Yeah. Okay. Thank you so much. And I think, again, there's that point of like that it's throughout the process, essentially, like before even arriving in these prison settings, that sort of treatment is in place, I think is key. Yeah. Okay. Thank you so much.
Key message around alternatives to conviction or punishment is really, that we need sufficient access to evidence-based drug use disorder treatment in the community. And that is very, very often a challenge. It might lead to many more people than we would wish to end up in contact with the criminal justice system. And I mean, I think the data from the New World Drug Report are not much more encouraging, right? There is still a huge gap in terms of accessibility of drug treatment.
Yeah, thank you. Okay, so on to the next question, which deals with another group of another special group, let's say. Are there treatment and care options available specific for athletes with drug use disorders related to synthetic drugs?
That's a tricky question. Thanks for it. And I mean, first and foremost, I think I would see how athletes obviously can be affected by similar risk factors or protective factors, right? Like other people in the general population, right? Also, if you're an athlete, you might have a family history of substance use, you might have been through certain traumatic experiences, you also might live with other mental health disorders and so on, right? So I think a number of things that would affect each and anybody of us who might develop a substance use disorder would also affect athletes. So then, I mean, if we think about it, and, I think there are a few epidemiological studies that show kind of that especially the use of synthetic stimulants sometimes kind of has an overlap with athletes, and maybe also other athletes that are taking other sort of medications that are supposed to enhance their cognitive functioning or the way they look and so on. So it becomes kind of part of, you know, this broader, how do I intend kind of to be more effective and so on, right? Obviously, there are risks associated with this, and like, you know, with any non-medical substance use. The other thing that I can think about is that, you know, among athletes, you know, there might be also this issue around addressing pain, you know, and that pain medication maybe is kind of another area of increased risk, right? So, I mean, I would say in that sense, it's really important to also go to trusted sources and double check what you are taking, right? So it might be taken with a good intention. Maybe some sports colleague has given something, you know, to a person saying, well, you know, with this you build more muscles, with this you'll be slimmer, with this you can run faster, and so on. But I think, again, like I maybe said at the very beginning, it's really important here to consult with a trusted healthcare professional. And obviously, if after an initial screening, or which can be done also by primary healthcare professionals, you know, if there is a need for further drug treatment, to really refer to specialized drug treatment services that can look more into, you know, what is the substance we are talking about, and depending on that, then develop a treatment plan that works for the person who, you know, might be an athlete at that point, and, you know, might want certain things kind of from the substance they are taking, while kind of seeing the risks that they are putting themselves to, or seeing kind of the negative side effects that they're seeing. And there is a strategy called motivational interviewing, right, which is very well posed kind of to deal with that and help people develop individual treatment plan that works for them. And which, referring back to the toolkit, you find something about in both the international treatment standards, in the treatment training materials, and so on. I mean, maybe to say that, you know, now coming in from another side, I mean, there is also growing evidence that exercise and sport might help kind of addressing underlying symptoms such as depression, or also for people that are in a phase kind of recovery, especially from methamphetamine use disorders. Researchers are looking more and more into the beneficial effects of exercise here. So I think that can also be looked into. And I mean, I think other than, you know, what general treatment would look like, I mean, especially for people if they are very, you know, interested, they want to continue with their sport and everything, like we spoke before about relapse prevention, I think one thing to consider might be, you know, to change the environment, because if the place where you have been going to do sports kind of is also the place that has been associated with substance use one way or the other, then, you know, that might be maybe a thing to consider as part of the recovery planning that you're doing. So.
Thank you. I think this was also a reminder that the phrase synthetic drugs is a broad one, and that it can, you know, encapsulates stimulants, that it includes all these different substances, and that like that also influences the type of treatment and care. So that it's a broad term, essentially.
Yes, very much so. And I mean, for some type of substance use disorders, we do count on both psychosocial and pharmacological treatments, right? For others, we count on psychosocial treatments, maybe then with symptomatic pharmacological treatments, but those are more limited when it's not about opioid use disorders.
Mm-hmm. Yeah. So, which brings me to the next question, which we slightly touched upon, which was, aside from medication, what sort of behavioral therapies are effective in treating people with drug use disorders related to synthetic drugs?
Okay, yeah, that's a great, and I think very linked to this question, right? And again, I mean, especially if you look, for example, at the international standards for the treatment of drug use disorders, our treatment training package, and I think there is the WHO MHGAP package is linked, right, for also treatment in primary healthcare, and behind the WHO MHGAP package, actually there is a so-called evidence center, where WHO does regular reviews and updates the evidence, including on what kind of behavioral interventions are working and are recommended. So, and I mean, behavioral, or we often say psychosocial therapies, are really key to treatment of substance use disorders, like we just said, right? Also for a few, there is actually effective medication available, not for all. And I mean, one of those behavioral interventions we have mentioned before, that would be cognitive behavioral therapy. So that really helps people to both identify and address certain thought patterns that they have that might be associated with drug use, but people also learn very concrete skills kind of to cope, to recognize, as we said before, triggers, and then find, with support, healthier ways to deal with their situation, especially when they encounter stress or when they feel cravings, right? So when they feel this very strong desire to return to drug use, so that they learn kind of alternative strategies that might work for them and might not be the same for everybody, what to do then. So cognitive behavioral therapy would be one. I think I've mentioned motivational interviewing already before. So that's a very client-centered approach where kind of a therapist would engage with a client and really find out, you know, what were the reasons or the motivations or maybe the expected outcomes for taking a certain substance, right? So maybe being more connected with others, feeling better, feeling less depressed, whatever it was. And so to say, what at this moment worries them about their substance use, right? So maybe that they're getting worse in school, that they cannot wake up in the morning. I don't know, that they, you know, have other health risks associated, but really work out for people what for them would be important to reduce or stop kind of the substance use and what are their priorities. And as we were in the beginning speaking, you know, it's not all about health. Sometimes, you know, it's also important for people to say, well, I really need to find a house first so that I can sleep and then I think better. So, and to help people kind of along these lines. So CBT, cognitive behavioral therapy, we said, motivational interviewing. There is another very potent behavioral strategy that especially seems to work well for stimulant use disorders, but it also seems to be very hard to translate it to actual community settings, and that's called contingency management. And contingency management is based, so you would basically, for a desired behavior, give people a reward, right? And it has been implemented in different ways. So it could be, for example, that people would receive, I don't know, a voucher or a cinema ticket or a bus ticket. I mean, really very different things, sometimes also money, especially clinical studies when they, for example, present with a drug-free urine test, right? So, I mean, I think this can be adapted in different ways, and also maybe treatment goals in this sense can be adjusted, but kind of rewarding desired or positive behavior has shown to be very, very powerful, at least in clinical studies. I mean, there seem to be challenges of implementing that in the real world. It has been done, but given how effective it is in studies, one would really hope that it becomes more available. Another one which UNODC is also rolling out is related to family therapy. So we have developed, and ours is especially for adolescents with substance use and substance use disorders. We have developed a training package on family therapy. And so that would really kind of see substance use in context, right, of a wider system, such as the family, maybe address underlying family contacts, see how the family can be supportive in changing substance use behaviors. Also, I mean, there might be this thought that, you know, somebody in the family is carrying a symptom, right? And substance use might be a symptom, whereas, you know, so if it's not treated in a family context, while one child might get better, another child might start developing problematic behaviors or something like that. So also from that perspective, it is important. And family therapy has been shown to be able to reduce substance use, but also to reduce criminal justice involvement of young people. And UNODC, I mean, more or less based on that family therapy training package that you can find in the toolkit under the treatment training materials. So we have demonstrated the feasibility of this in a very, very real world context in a middle income country in Indonesia. And many of the family therapy studies work with highly trained psychologists and all of that. And there is always the question, but does that still work if you take it to the real world? And in this feasibility study that we have done, we have really worked with a workforce that was there. And the workforce that was there were to some type maybe psychologists that were working in the area, but it was also a lot of peers or other service providers that got involved, and the initial results have been very supportive. And then there are maybe some other things. I mean, maybe I'll mention especially peer support groups such as Narcotics Anonymous or so, where to some extent it's maybe harder to demonstrate the evidence of such. But I mean, they are very, especially during recovery, can become a very important resource for people. And for many people, it seems to be beneficial to join meetings and to find support from people that have been through similar experiences. So just to say, I mean, there are a number of those, there are others around, but I would say cognitive behavioral therapy, motivational interviewing, contingency management, maybe family therapy are some of the key ones. And that, there is always this thing that not one size fits all. Everybody would need an individualized treatment plan. And that is both for, the type of therapy offered, the type of additional support offered. Because if we speak, as we said now a few times, about psychosocial support, it's not only the psychological therapy. People also need something to eat. They need a place to stay. They need a perspective where they can meaningfully make an income and so on. And yeah, and I think, there's good read up of all of those, including in the toolkit.
Yeah, thank you. I'm also sharing the links as you reference them. So they're all available in the chat. So to the next question, which kind of deals with another phase of treatment. This came from Slovenia. Someone asked, how long does the detoxification phase of treatment for people with drug use disorders typically require?
Yeah, that's a good question. And to some extent, and based on what we said throughout this meeting already, the answer is obviously it depends, right? So it depends what people have taken. It depends on the individual person, on the circumstances and so on. But I think in generalizing, right? Generalizing, I mean, you can say that there are certain synthetic substances that might be either longer acting or that might be more potent than their, let's say, traditional equivalent, right? So, and I think I've seen somewhere an estimate. Again, all of this depends, right? But if you would say that for heroin withdrawal, you would need whatever, a few days, a week, maybe, then maybe for or kind of withdrawal management, which is, by the way, another word for detoxification of the longer acting opioids, such as, for example, methadone, it would just take slightly longer. But there are ways in which doctors and in which health drug treatment systems can support people in this. So especially opioid withdrawal, there are effective medications to help with that, right? I mean, both methadone and buprenorphine have been used also in withdrawal management. And there are also other so-called alpha adrenergic receptor agonists, medications such as clonidine or lofexidine, that can help kind of make this process less unpleasant, right? Because I think another thing is that, you know, as a clinician, you want to make this phase as less unpleasant as you can, right? Because it's really part of the entire treatment experience. And then maybe just to say that in the international treatment standards, we have been very clear that detoxification alone cannot be considered as drug treatment. You know, further treatment interventions that are much more based on a continuum of care and comprehensive services would be required, and especially kind of with detoxification from opioids, but to some extent also with other substances, there is actually an increased risk of overdose after detoxification alone. And that's basically, you know, if you have gone abstinent for a while through this detoxification process, also your tolerance levels kind of have been reduced. So that might mean if, you know, then you leave the setting in which you have done your detoxification and, you know, you maybe start relapsing, you start taking drugs again and you take them at the same level that you have taken before, but your tolerance levels are down, it's a huge risk kind of for overdose. So in that sense, I mean, for opioid use disorders, I mean, the most recommended intervention, I mean, for opioid dependence, let me say, would really be treatment with opioid agonists. And that would be, for example, methadone or buprenorphine, right? And longer term maintenance treatment, right? So not only detoxification, but think kind of a continued pharmacological treatment approach. And for some people, especially people that are well integrated or people that have a lot of family support, there are also medications such as naltrexone, kind of which are not opioid agonists, but antagonists, and that work in a way that when you take an opioid, you would not really feel the effect on it. But that, let's say, works for less people maybe than it works for other people. So, I mean, in very general terms, I would say with synthetic drugs, maybe be prepared for a slightly longer time of supported withdrawal management, called also detoxification, right? Keep the risks of overdose in mind and see how you can support people through the withdrawal management process. You know, if there's no pharmacological treatment per se available, see if at least symptomatic treatment can be availed, like, you know, sleeping support or pain medication if adequate, to make this less unpleasant. And always think kind of a mix of substances that people might have taken. I mean, especially if they are taken like supposedly synthetic drugs that they've bought on the street. I mean, you do not really know what they have taken. And then they might have combined that with alcohol, with benzodiazepines and so on, just to keep that in mind. And especially with central nervous system depressants such as alcohol or benzodiazepines, there is kind of also a risk that withdrawal itself can be life-threatening. And I think also the general advice is that any potentially slightly more complex withdrawal should really happen under medical supervision. And maybe the last thing to mention what I said before, it's basic, but, you know, not to forget the importance of hydration and not letting people go into dehydration during any detoxification processes.
Okay. Thank you. I'm just looking at the time and the hour has gone by very, very quickly. So I think, unfortunately, we're at our last question. So I think I'll sort of pull this question up because I think it's quite relevant to also the theme of World Drug Day today. So it deals with stigma, actually. And the question is, in our treatment center, some patients are scared of seeking help for their drug use disorders due to the fear of adding shame to their family and relatives. How can treatment and care providers reduce this fear?
Thank you so much. I think it's a great question. Thanks to whoever has asked it. And as you say, I mean, very timely also for today. Maybe just to share with you that I'm coming back today. It's really my first day at the office after I've been 4 months on a sabbatical, and I spent quite a lot of time in clinical services, including clinical services that are really used by very marginalized populations of people using drugs, injecting drugs, homeless, and so on. And I think from that I've learned a bit, but also maybe let's start with, I mean, what you have in the toolkit and the work that UNODC has done around it. So I think following a CND resolution that, I mean, so the Commission on Narcotic Drugs, UNODC steering body, has passed a resolution kind of to address stigma. And based on that, UNODC has hosted an expert group meeting and has looked more into what do we actually know what works to reduce stigma. And one of the things that came out that in general kind of could work are really contact interventions, right? So that you have personal experience, right? And with people using drugs, and maybe we overcome our cliche here, right? So people with a history of drug use disorder might be the ones working with us, might be our neighbors, might be our brothers and sisters, and so on, right? So, and it's not the only thing that defines somebody to have a history of psychoactive substance use. So, I mean, I think the other thing which really for health services is important is to have and to train all the staff on what is often called person-centered care, right? To really take somebody where they are and not put your goals and your objectives on them. But when somebody comes to a health center, may it be primary healthcare center or may it be a specialized treatment center, they have already been very brave because they are coming to you to seek guidance and support for something that's why the question is there, is highly stigmatized by society and, is often associated also with legal consequences, right? So when they come, they really need to find an open door and somebody that says, how can I help you? And I think this person-centered, again, means a lot to listen to people and not say, how can I help you become immediately abstinent from drugs? But what are the steps that you need to take, right? So that you can make or start a journey of being more healthy and being more integrated. And this might be like, maybe they need to clear first their hepatitis C status. I mean, for hepatitis C, we now have treatments, and it's kind of a huge achievement for somebody. And, people that are using drugs, people that are in treatment for drug use disorders can successfully be treated for hepatitis C. And, and it's a huge success to have done that for yourself. And that might be your immediate need. And then, so to say, addressing your drug use maybe might be the next need that you need to address, right? So, I mean, I think person-centered care is something that really helps health services to be less stigmatizing. And I mean, from people using drugs, I've often heard that some more, let's say, lower threshold, less conditional services, they feel more they can access. But things like sitting in a waiting room of a normal hospital or how they are treated in emergency settings of hospitals, that's often more challenging. So I think as a health system in general, we also want to come to this no wrong door, right? So either if you enter first and get in contact with an emergency service, a primary healthcare provider, an outreach worker, or a specialized drug treatment center, you should find an open ear and access to services. One thing that in concrete sometimes also helps is the involvement of peers or people with lived experience that then obviously, would need to be trained well, they should be paid, all of that. So they would join basically as professionals a service. But, given that they've had the experience, they often can provide very good guidance to the rest of the staff, how to be more welcoming and so on. In the TreatNet training package, we have also featured a certain quality kind of evaluation process, which is called NIATEX. and it includes a number of tools or interventions that you can do. One which I think is especially interesting is a walkthrough. Like if you're the director of a health service, you kind of basically call as if you're a patient and you see really what's the experience for somebody entering your service, where you have to wait, how you are treated, and all of this often can lead to improvements. And maybe, and you, I think, have a poster on these quality assurance for treatment of drug use disorder tools that we are developing as a derivative product from the international treatment standards. So we have defined quality assurance standards together with WHO and other partner organizations. And we just recently also did a review to see from all of these, which are in addition have already key evidence established to also improve treatment outcomes. And so maybe with those three, I leave you. And that was quick access to evidence-based services, you know, avoiding long waiting lists. Quick access to evidence-based services was one. Then the other, which I've mentioned already, person-centered care, right? Guide people based on their needs and not a one-size-fits-all approach. And then the last, I think we've also touched upon in the call, is continued care, which might mean different things for different people, right? But that after an intensive, maybe clinical treatment phase, there is continued support from different health and social services.
Amazing, thank you. I think I'm quite familiar with the stigma resource, and I know that actually it has lots of great case studies included in it, so you really see like the practical implications of it. So I've also included that in the chat, and I really recommend taking a look at this. And yeah, with that, I unfortunately would have to draw a close. And I just want to mention that actually we did some of the other questions that we had received in an earlier session of this. And we'll have both of those sessions posted on the Toolkit website in the next few days. And thank you so much, Anja, for really providing your expertise and addressing these really important questions. So thank you so much.
Thank you so much. It's a pleasure. And as you said in the beginning, the box to ask questions is always there. So yes, reach out to us. And, you know, again, going back to what I said in the beginning, if you or a loved one kind of has problems with substance use, it's really important kind of to seek support from a health service provider in your area also. So yeah, thank you so much.
Yes, thank you. All right. Have a wonderful day. Thank you, everyone, for joining us, and we'll speak soon, I hope. Thank you.
Bye-bye.